So the next thing you need to know is how safe is it? And throughout the literature, in about 350 cases reported throughout the world, the incidence of an adverse reaction is 0. In our study of 77 patients, there were 4 patients who, subsequent to the fecal transplant, developed a new disease. So you could raise the issue, did they just develop that disease, or in fact, was that related to the transplant? And one of them developed Sjogren's disease, which is an autoimmune disease, and one of them developed idiopathic thrombocytopenic purpura, or a low platelet count, ITP, also an autoimmune disease. And there were isolated instances of other diseases, none of which was clearly related to the fecal transplant. So I think that fecal transplant is looked at, certainly in my judgment, as something that is rapidly effective, safe, inexpensive, certainly compared to the antibiotic costs of treating it in a conventional way, and something that's relatively easy to do. And I would challenge anybody to tell me another disease that's as severe as C. difficile that you can treat with an agent that is rapidly effective, essentially has no adverse reactions associated with it, and give you a 90% to 98% cure rate. So this is unique in medicine. That's very exciting. But even more exciting is the use of fecal transplant for a wide range of diseases. Not only those within the GI tract, but some outside of the GI tract. So in the GI tract, we have irritable bowel syndrome that's diarrhea predominant. We have some cases of constipation. We have some cases of bloating with diarrhea. And we have we have inflammatory bowel disease, specifically ulcerative colitis. And we have several patients now that we have managed with fecal transplants when they were not responsive to the most potent agents on the market, the biologic agents, such as infliximab and adalimumab, and they responded to fecal transplant and are in remission on just fecal transplant therapy. So that's very exciting. And then you have the range of diseases outside of the GI tract. Parkinson's disease, multiple sclerosis, some patients with myoclonic dystrophy, autism, and morbid obesity. I actually did